I'm Dr. Sri, I'm a board certified family medicine sports medicine doctor. In this video, we're going to discuss whether platelet-rich plasma, also known as PRP, can help heal an ulnar collateral ligament tear at the elbow and whether this PRP can help the athlete return back to sport sooner or not. So without further ado, let's get started. So let's talk a little bit about the ulnar collateral ligament. So the ulnar collateral ligament is a ligament right at the medial aspect, so basically on the inside aspect of the elbow, and that spans the bone called as the humerus here and the bone ulna here. So basically the ligament attaches just like that. So this ligament helps to provide stability to the medial aspect of the elbow. So basically make sure that the elbow joint doesn't collapse like this. So anytime when you're playing a sport such as like pitching during baseball, or a quarterback like throwing the football, or like when you're throwing a javelin throw. So these things can put a lot of undue stress on the elbow joint and thereby creating ligament tear at the elbow. So usually when an athlete presents to me, so they were doing pitching, and suddenly they develop an acute throbbing pain at the medial aspect of the elbow. Some people might say that they felt a tearing sensation on the medial aspect of the elbow. So after that, I'm performing my exam to see whether the ulnar collateral ligament could have been injured or not. So I'm doing a stress testing to see whether the elbow joint is pretty stable or not. And after that, sometimes I'll use a point of care ultrasound to look at the integrity of the ulnar collateral ligament. And if my suspicion is really high, then I would get an MRI to look at the ulnar collateral ligament. So based on the MRI, we divide into 3 grades. So grade 1 is just basically a swelling in the ulnar collateral ligament. Grade 2 is a partial tear at the ulnar collateral ligament. And grade 3 is a complete tear of the ulnar collateral ligament. So usually when an ulnar collateral ligament tear happens, so there's going to be a lot of bleeding at that site. And this bleeding activates the inflammatory cells to come and repair the tissue. However, if the ligament is torn too much, like let us say the person has a partial tear, or let's say they have a complete tear, then there are chances that the body may not be able to heal the ligament tear completely. So based on managing these injuries for quite a while in the sports medicine world, the consensus among the American shoulder and elbow surgeons is that UCL reconstruction, so basically a ligament reconstruction, should be recommended for a full thickness, which is basically a complete ulnar collateral ligament tear, as it is less likely to heal the ligament on its own. So what about partial ulnar collateral ligament tear? So studies show that the grade 1 and grade 2, which is basically sprained UCL as well as the partial ligament tear, around 80 to 90% of the people can return back to sport just with rehabilitation alone. And the time frame would be around like 8 to 12 weeks for them to return back into sport. So the questions I would like to ask is that, can PRP heal a grade 3 UCL tear without having to consider surgery? And the next question is that, can PRP help me to get back to return to sport sooner if I have a grade 1 or grade 2 UCL tear? So first let's understand PRP. So PRP, also known as platelet-rich plasma, is when one's own blood is taken and there is centrifuged to concentrate platelets and leukocytes. The platelet-rich plasma, they contains growth factors, which are proteins that promote tissue repair, and they can trigger cell proliferation. So basically they help heal the tissues and they stimulate tissue regeneration in the treated area. It is also important to note that when there is an acute injury, there is bleeding around the tissue, which itself stimulates this cascade of healing, which is why most people get better with rehab alone. However, by using PRP, we can theoretically assume that we are probably speeding up the healing process. So there is basic science evidence both in lab studies and animal studies that PRP indeed can promote ligament and tendon healing better than without PRP. Can PRP enhance the healing of the UCL tear? So basically, can it help to speed up the process of healing so that the athlete can return back into sports sooner? The biggest problem that we have is that we don't have a standardized preparation of PRP. So what that means is that and one athlete could get a different PRP in one office, and he might get a different type of PRP preparation in another office. So there is no standardized PRP concentration. The machine also can deliver variable amounts of platelet concentration. So one thing that I can say with confidence is that this machine can concentrate this platelet so much, but for each individual, it may vary. In addition to that, there are other products in the PRP, such as leukocytes, which we don't know whether the leukocytes aid with healing or they can hinder healing. So when you look at the studies, some would have done the injections using a leukocyte-rich PRP. So basically PRP that is rich in leukocytes. Some would have done PRP that is leukocyte poor. So basically not having a lot of leukocytes in the PRP. So because of these high amount of variability, it is always becomes harder to make a firm conclusion. But still, we have some good research studies to answer our question whether the PRP is going to help with healing or not. So last year, a systematic review was published, which basically means pooling all the studies that has been done to date, comparing PRP versus no PRP. So these are all case series, which is not the strongest evidence in the research, but still, based on their study results, the conclusion was that there was no significant difference in the return to sport or return to prior level of play rates between patients treated with PRP and treated without PRP. The return to sport varied depending on the grade of the UCL injury, with grade 1 having the highest rate and grade 3 and grade 4 having the lowest rate. So grade 4 is basically multiple levels of injury at that ligament. In addition to that, in one case series study, 3 patients treated with PRP injections developed too much of inflammation likely that caused fibrosis surrounding the ulnar nerve, and thereby they need an additional surgery to release the ulnar nerve. So again, these people already had problems with ulnar nerve prior to getting the PRP injection. So in summary, we can answer our 2 questions here. So the studies show that for grade 1, grade 2 UCL tear, the PRP is not superior when compared to rehabilitation alone. And the second question was that does the PRP help to prevent a UCL reconstruction if you have a grade 3 UCL tear? And the answer doesn't seem to be that way. So which means that if someone has a full thickness UCL tear, then that person might highly likely need a UCL reconstruction to get back into sport. In addition, we saw one complication in a case series study where they developed some fibrosis around the ulnar nerve. Again, this is a very a rare complication, and these people already had some problems with the ulnar nerve. But still, again, this all points out to the risk and benefits. So the PRP do come with slight risk compared to not getting any injection and just doing rehabilitation alone. So there was one study that looked back at the professional baseball players who received the PRP injections, and we call this a retrospective cohort study. So basically not the strongest evidence though, but still a good way to look at how these professional baseball players did. So based on the study looking back, people who actually got PRP, they had a delayed return to play. However, the problem is that we don't know why some people got PRP whereas some don't. My assumption would have been that maybe that person had a severe extent of injury, or maybe they were symptomatic after like few weeks or so, which is why they got the PRP. But certainly, even though it's very hard to conclude that PRP actually delayed the return to sport, certainly I can say with confidence that the PRP did not help them to get back into sport sooner. In addition, in that particular study, it also showed that people who had a full thickness tear, so basically grade 3 UCL tear, did not do well with PRP alone. So with these findings, usually I tell my athletes in my practice that we don't have to jump to PRP right away after an acute UCL tear. Most people do well with rehabilitation alone. Remember, PRP is not covered by insurance in the United States, so most of them come with a pretty hefty price. But what about the athlete is trying to get back to sport with rehabilitation alone, but they're doing rehabilitation for maybe 6 to 8 weeks or so, and they're not improving? In that case, is PRP worth a shot? So in order to answer this question, I'm going to look at 3 papers. Even though these papers were included in the systematic review, I want to review these 3 papers separately and provide an answer for this question. So based on these 2 studies, it is worth trying PRP if one is failing considered treatment. Again, with grade 3 tears, it is very questionable whether PRP might work. One study has shown that they have tried PRP in grade 3 UCL tears and has helped some people to get back into sports without surgery. It is also important to note that in this particular study, there was no control. So when I say control in the sense, for example, let's say 2 months I did considered treatment, I didn't get better. How about I just maybe take a break and then do another 2 months of considered treatment without PRP? We did not have a control group like that. So basically we're assuming that just because the person has failed considered treatment and then they did the PRP injection, maybe the PRP injection helped them to get back into sport again. But still, at that point, at 2 months of considered treatment and they're not getting better, most of the athletes want to try something different in their rehabilitation plan so that they can actually get better. So in my opinion, if someone is failing considered treatment after 2 months, it is not a bad idea to discuss about PRP and consider PRP treatment to help them to get back into sport. Now with grade 3 UCL tear, usually I tell people that it is very unlikely that it may work. However, certainly there are some people that have got benefit from PRP for grade 3 UCL tear also. So if one wants to consider before considering surgery, certainly they can try it. But my honest advice would be there is a high chance that you might pay the price for the PRP and you may not get benefit. And I feel like the athletes should know about this before they spend their hard-earned money for a PRP treatment. I hope this video is helpful. If you have any questions or concerns, please post in the comment box below. If you want to know more about PRP, the complexities of PRP, make sure that you check out this video here. And I'll see you in the next video. Until then, goodbye.